Hello, and welcome to the daily podcast of the Heartland Institute, where we discuss free market approaches to public policy problems. Today, healthcare. My name is Anne Marie Schieber. I'm the managing editor of Healthcare News, and I'm also a research fellow at Heartland. Recently, a Gallup poll came out that found Americans were skipping treatment because of the costs. Now, many of us are used to having someone else pay for healthcare, but nothing is free. In healthcare, rising costs are passed down through the form of copays, premiums, and deductibles. One solution is to eliminate the third-party payment system, where patients and providers can work independently, and prices would come down because they would reflect natural market forces. Providers wouldn't charge what consumers can't or won't pay, and consumers will reward providers who give them maximum service. Well, we have a system like that. It's called direct primary care, where no insurance is involved. Patients, or members as they are called, pay a flat monthly fee, usually under $100 a person, for unlimited primary care. The concept has been around for several years, but still many people don't know what it is, including doctors. Which brings me to my guests today. Adam and Christopher Habig and Rishi Patel are the force behind Freedom Healthworks, a company they started to help providers launch direct primary care practices. Welcome, gentlemen, and thank you for joining me.
Hi, Emery.
Hello. Hello, Emery. Good morning.
Christopher, I would like to start with you first. Tell me when and why you and your founders started Freedom Healthworks, and what has been the demand for your services?
Yeah, good morning, Emery. Thanks for having us. We formally started Freedom Healthworks almost 4.5 years ago now, in the summer and fall of 2014. It's kind of a personal story, really, and still a lot of family ties. Obviously, Ab and I work together, and we're brothers here, so we've been involved since the beginning. And what we saw back in 2014, coming off of some extensive experience in the medical industry that Adam had, was a shift in physicians' mentality and kind of, you ask a doctor if they would recommend if their kid would be physicians, and 9 times out of 10 they would say no. And so both of our parents are physicians, and were nearing retirement age, but they still had a lot of good years left in them. But they were so burnt out from and just tired of the experience that they had with insurance companies and reimbursements, struggling to get the money that they deserved into their practice, and they were struggling to take care of patients in the way that they really wanted to, that's the way that they've been practicing medicine for the last few decades. And so I remember our parents sat us down and said, "Hey, we're looking to retire here." And we said, "Why? You guys have another 5-10 years of of your career left in you to take care of your patients." And these arguments that they put out made a lot of sense. They're seeing 30, 40 people a day, and they're getting older, and they're getting tired of being on the hamster wheel. And so my dad is a FAA senior medical examiner, and he said, "I think I just want to stand a placard outside my office and just see pilots all day, and then I could talk about planes and talk about some fun stuff and take as long as I need to with them. I'm just going to charge them cash." And that was said with some chuckles. And then we said, "Why don't you?" And he kind of said, "Well, I don't think I can. Is that legal?" Yeah, it was a real conversation. Is that legal? Can I choose not to take insurance contracts? Is that a thing? Because that sounds amazing. And we said, "You know what? We're going to look into that for you." And so we spent about a year and a half just researching direct primary care, and a lot of lessons learned in concierge medicine from some doctors who've been doing it for a while, and found this burgeoning movement that was just starting to percolate up from the surface. And we said, "Wait a minute, there's something really cool happening here within the country, within some of these innovative doctor offices." And so we kind of did a roadshow, and we talked to a lot of DPC physicians out there. Some of them knew about DPC. Other ones said, "I didn't even know that was a thing. I just decided to start charging $200 an hour, and if anybody wanted to come see me, then they could come see me." And so what we're able to do is take a lot of those kind of the best of both worlds of all these physicians that we're seeing and say, "Okay, we can make a replicable model here because our background is really in the startup space and helping people start their own small businesses and get off the ground that way and figuring out what kind of loopholes to jump through. And so we said, why don't we just apply this to direct primary care? Medicine has been something that has been in our blood, obviously, with our family. None of us chose to go into medicine. I think I was probably the closest, but with the advent of the ACA, said, nope, that's not going to be good for me. So went more of the business to see if we can really make a difference in healthcare using DPC and helping like-minded physicians exit the corporate system and go back into independent practice again.
What an incredible story. So you had a personal interest in wanting to get into this new model. Christopher, how has DPC grown? I know you've only been in business for a couple of years, but how have you seen it change in the last couple of years since you've been in FreedomWorks? And then also talk to us about what a typical practice is and what the cost is in starting up.
Yeah, it's really been a remarkable growth, not just within Freedom Healthworks, but within the overall DPC community across the nation. I always joke that when I mention direct primary care now, people don't look at me like I have a third eye in the middle of my forehead. People start to understand exactly what that means, or they have some idea of what DPC is. A lot of people will be like, wasn't that like concierge medicine? And we say, no, those are kind of cousins, where concierge is going to be charging insurance still, and DPC is just the pure no third-party payer type of a model. Throughout the country, since it's such a grassroots and independent movement, it's hard to put an exact number of physicians out there. Our best guess is about 1,000 or so pure DPC physicians, and probably 1,000 or more concierge type of practices. And that's one of the cool things that sets this movement apart, is that it is really physician and patient led. It's not led by any type of bureaucracy. It's not led by any type of corporation. We try to control these physicians and control the care for the patients. A typical DPC practice will usually be about 500 to 600 patients that one physician sees. We always recommend that one physician has 1 or 2 employees. And we can help gauge that as they continue to grow. If you're starting from 0 patients and start from scratch, you probably don't need a full-time employee, and you want to keep expenses as low as possible. But once you're a mature practice, hopefully within about 2 years, you can have 1 full-time employee there. Most of the time, these DPC practices will be charging anywhere from about $50 to $125 a month. And the cool thing there is that the DPC physicians are free to charge however much they want according to their locality. So we talk about a lot of transparent costs. We talk about making care actually affordable for the local community. We see physicians as really pillars within their local community. A lot of people in your town, your city know who you are as a physician, and with good cause. But we've talked to some physicians who are in Appalachia taking care of some really poverty-stricken areas, and they charge $20 a month for basically all you can access primary care. Unheard of in any type of government initiative concerning healthcare.
That's incredible. And unlike, I guess, being on Medicaid, they can actually get in to see a doctor. A DPC operates outside of insurance, obviously. Members, though, still have to figure out how to pay for specialty care and hospitalization. Are there enough options to make DPC affordable and to be able to satisfy the specialization and the hospitalization that members might need?
Yeah, that's a great question. That's something we hear all the time. Primary care can satisfy about 80 to 90% of the average person's healthcare needs each year. Obviously, there's special cases, and that's what people really want to zero in on, is the what-if scenario. We always recommend having some type of insurance. We always view health insurance as a financial tool. So people like to make the comparison to auto insurance, or I like the comparison to homeowners insurance. If you've got a busted toilet or your shower starts to leak, you don't file a home insurance claim. You get it repaired because that's typical maintenance. Same thing with our bodies and with our health. With a DPC plan, you get all the maintenance that you need, and then you save your insurance for any type of catastrophic accident. I understand that health insurance is a pretty hot topic, obviously, past a decade or so, and rightfully so. So if people think of health insurance as being way too expensive, there are some really cool options that are starting to come forward, starting with either some short-term plans or the health shares are starting to really, really take off. The health shares are not tied to any type of religious service anymore. So people are able to really enroll in those types of health shares across the nation and only pay for the catastrophic plans and major medical that would complete in that what-if scenario.
Right, and association plans for independent contractors who want to pool together to get more affordable plans outside of the ACA exchanges. Well, thank you, Christopher. I now want to turn to your brother, Adam Habig, who's the president and co-founder of Freedom Healthworks, to get more into the nuts and bolts, the legal and financial hurdles that doctors face. Now, let's face it, many doctors like the fee-for-service model because it pays the bills. How much of a financial risk is it to start a DPC practice?
Well, Anne-Marie, you're going to hear from a doctor in a second who has made that choice, but I would say any business entails risk upon launch. But direct care is really about financial liberation for doctors. In fact, I'd say doctors today face greater financial risk trying to survive on declining insurance reimbursements in the traditional system, where they not only run the risk of being forced to practice in a way that really serves insurance companies instead of patients, but financially, they're being forced to bear enormous overhead expenses just to get paid through the insurance reimbursement system. And while those costs continue to increase, they have zero control over their own pricing in their own businesses. That's terrifying. So the result is that today traditional practice physicians rush dozens of patients through their exam rooms every day just to keep the lights on, or if they're employed to meet the quotas that are set by their hospital employers. DPC, direct care, rebalances practice finances, and it cuts the administrative overhead, the operating costs, and it allows practices to become more profitable by lowering the prices they charge to patients. As crazy as that sounds, that's part and parcel to this model. Practices become more profitable, more financially secure, actually lowering the prices their patients pay. And Freedom Healthworks in particular, we enable doctors to minimize that risk by running very lean, by operating efficiently, and by leveraging the best of the digital economy to attract patients to their practices, to their businesses. Just case in point, the latest statistic I saw, the average personnel required for a physician in traditional practice today, Anne-Marie, 4.5 FTE. That's significant overhead in terms of personnel. In DPC, you see that drop to 1 or maybe 1.5 FTE in terms of supporting cast within a practice. And again, the expenses borne by the practices when they have to ramp up that administrative and those operating expenses, that is borne out in the prices that they eventually must charge, or the reimbursements that they must collect to cover that. So again, I think DPC flips the script for practices today and for physicians who have enormous investments personally in training, both in time, in terms of the years and years it takes for physicians to train, and the years they dedicate, and the money as well. Many physicians today graduate into practice with enormous debt. I think direct care is the mechanism by which practice finances can be rebalanced so that they have real choice in terms of their career paths.
What about the legal and policy hurdles? Can a DPC practice accept patients, for example, on Medicare?
Absolutely. And this is a common misconception. Chris alluded to this earlier. Many physicians and many of those outside the medical community, they look at our healthcare system today and they don't realize that there are options out there, that you don't need to simply plug in to this insurance reimbursement driven system that we're all dissatisfied with. But there are true free market options. And It's as simple as two willing individuals, one a purchaser, one a seller of a service, contracting directly. And you'll find that when you back away from these voluntary commitments that both patients and physicians enter into in the expectation that some third-party payer needs to be involved in that transaction, so much of the headache, so much of the legal, the regulatory, the hurdles you mentioned absolutely fall away. So to answer your question directly, DPC practices, direct care practices, accept all patients. And we like to say at Freedom Healthworks, they're the only practices that are truly open to all comers. Insured, uninsured, old, young, doesn't matter, network or none. Anyone is welcome within a DPC practice. It really is. It's truly a free market innovation that is, especially for those who are uninsured out there today, which are we have a sizable population in America, despite the last 10 years of reforms, where they can walk in and pay the same price for the same great care that someone with the best health insurance in the country is going to get. And that's really cool. So absolutely, Medicare patients, Medicaid patients, VA patients, I mean, anyone is welcome in these practices, Anne-Marie.
Okay. A lot of people who have private insurance, it's cheaper than their copays, except for their free annual exam. But, they don't have copays, deductibles, premiums, whatever. All right. So I want to ask you a couple more questions regarding employers, for example. Can they incorporate DPC into their benefits?
Absolutely. This is where we're seeing tremendous growth within the DPC community and tremendous growth in demand, I'll say. Employers are fed up and with good cause. They have been subject to year over year annual increases in their healthcare costs. And when I say healthcare, it's important to distinguish, and Heartland does a nice job of this, between health insurance and healthcare. But when they look at their P&L, they see a line item for health benefits, as they term it, that is grown by double digits each and every year without stop. They have decided enough is enough, and that in large part, the insurance companies that they were relying upon to hold down those costs have failed. And so they're beginning to look elsewhere for solutions. And one of those is to contract directly with those institutions and individuals who provide healthcare. And we're seeing this take place at the hospital level as larger employers start to contract directly with hospitals. And we're seeing it in our context at the primary care level as well. And primary care is critical because I've seen stats that say that for 90% of Americans, you get all the care you need every year from your primary care doctor. And that's why it's the most critical part of any health benefit. So when we talk about employers looking this direction, they're looking at this as a way, number one, to actually achieve transparent pricing, which is a revelation within healthcare, Anne-Marie. Pricing has been so murky for so long. No one knows what anything costs. And certainly even the folks who are delivering the care can't tell you what something will cost in the insurance and reimbursement system. That's a recipe for spiraling costs out of control. And that's what we've seen today.
Absolutely. All right. So I have one final question, then we'll circle back with everybody at the end. Can consumers use health savings accounts to pay for DPC?
Well, I'm not a tax expert. I hate to go on that limb, but I'll tell you, health savings accounts are used to pay qualified medical expenses. And certainly seeing a physician and paying for that service directly is a qualified medical expense. So I'll answer that in a qualified way. We do have many patients today that are utilizing health savings accounts and similar types of vehicles like that to pay their bills to their direct primary care physicians. Now, I'll say this, the tax code at the federal level is still a bit outdated. And in fact, there are different parts of the federal government that actually contradict each other when it comes to tax treatment of direct care, incredibly. So Congress needs to clear up the confusion around this topic. And this is something that the states have done a nice job in taking the lead when it comes to direct primary care. Over almost half the states now, to check, have affirmatively declared that direct primary care is not insurance and it shall not be regulated as such. And so Congress needs to follow suit and realize that direct primary care and direct care in general is emerging from the grassroots in a major way with the potential to really drive systemic change within healthcare and get out in front of some of these issues that sometimes trip people up. And that's a long answer to a short question. I understand that, but the HSA question is not so simple as yes or no because Congress has not given us black or white guidance. But I will say that many patients today are utilizing those accounts to purchase their direct primary care.
All right. Well, thank you, Adam Habig. I next want to turn to Rashit Patel, who is the medical director at Freedom Healthworks. Dr. Patel, how prevalent is burnout among physicians, and how can DPC help?
Hi there. Thanks for having me. I think burnout is something that is and has been prevalent in physicians for quite some time, and I'm happy that we are starting to really acknowledge this concept and looking for solutions to solve this. I think a lot of the research out there will show that practicing physicians that have been out of their training for a while are quite burnt out, especially with a lot of the administrative overhead. The really saddening thing is we're starting to see burnout in residents, in medical students, even in undergrad students, just with the pressures of the medical training the way it is and all of the rigmarole that goes along with that. So, we're not going to solve that here on this podcast today, but I think there is a huge prevalence of burnout. I think a lot of what causes this burnout is really the administrative burden on the physician. So, we can talk about physician pay and how much are they taking home in their paychecks. I think a lot of physicians would say that if you can just change and fix the system around me, I will be more satisfied. I think a lot of us that went into medical school and went, regardless of what specialty we went into, really want to take care of patients the best way we can. And I think we get frustrated when we are sitting in our offices or you're in the hospital and we just realize that, this is the way it has to be. I've got to see 40 patients a day. I've got to cut these corners because it's for my own sanity. This is the system around me. And that's a lot of times what leads to burnout is that we just don't feel like we have control over how we are providing care. And I think direct primary care completely flips that around. As I now have my own direct primary care office, I run the office the way that I feel is the best for my patients and the people that I'm taking care of. When I'm in the exam room with my patient, it's really just the two of us. It's myself and the patient. I don't have any influence from an insurance company or a government program, or I need to check these boxes to get reimbursement. It's none of that. It's just, what do I think is the best for my patient in front of me? And yes, I think as Adam had talked about, the financial risk of starting the practice, those things are still there. But for my kind of professional fulfillment of being able to provide care to these patients, it really is liberating and really takes a lot of that burden and overhead off of my shoulders, knowing that I can just provide the care the way that I want to. So I think this is one solution to helping with the burnout issue. I think there's still a lot of other things that are contributing to that. But I think direct primary care can definitely have a huge role in improving physician burnout.
Absolutely. Do you believe this model could work for specialty care?
I think it can to some degree, and I'll kind of take this in two parts. So I think the concept, as we talked about, of directly working with patients on the medical cost of things can easily work in any specialty. So when you take away the insurance company and the billing and the overhead associated with that, I think direct pay can work in any specialty. And I'll give the example of the Surgery Center of Oklahoma, which has clear upfront pricing on their website for all kinds of medical procedures. And I've actually had a couple of patients of mine who have gone from here in Indianapolis all the way out to Oklahoma to have a procedure done just because they were able to know upfront what the price of that procedure is. So
that's incredible. That's incredible.
And they, we had worked with some specialists here in Indianapolis, and they just really flat out could not tell us what the cost of the procedure would be until after it was done, and that was just unacceptable. So I think on that sense, it definitely could be done. When you look at the way direct primary care works, for the most part, where patients pay a monthly fee for essentially unlimited access to their physician, that will only work in certain specialties. A lot of specialty care tends to be episodic, or it tends to be procedurally oriented. And so for those things, it may not make sense to do things on a monthly fee. But there are some specialties that definitely work in that realm. Just a couple examples, an endocrinologist who might be treating a patient with diabetes, or a cardiologist that's seeing a CHF patient. And those types of scenarios where they are seeing that same specialist time over time, maybe a retainer fee or a monthly fee would work in that sense. So I think it, from kind of two sides of that, definitely the direct pricing can work in any specialty. Kind of the monthly fee that we use in direct primary care can work in some specialties, may not work in everything. but I think there is a role to look into that.
So I imagine technology is a big game changer for primary care. More and more diagnostic work being done at home. Now we have telemedicine. Do you envision a day when patients never have to go into a doctor's office? And if so, how does that relate to DPC?
So I'll be honest, I don't see a day when they will never have to come into the office. I think there's just still so much value on having that physical face-to-face encounter, the touch that we can provide when we're physically examining a patient. That's never going to go away. I think the role for technology is to make all of the in-between care much easier. This is one of the reasons that I went into direct primary care. I remember, let's say 5 years ago when I was still in my employed position, just looking at my schedule for the day, I think there was 25 or 30 patients on the schedule. And I looked down the list, and as I was just looking through all the patients, I remember commenting that probably half of these patients did not physically need to be in the office. They were only here because that's the only way that we could bill for them. You had to physically see the patient, charge their insurance, and get an office visit code. But if we had expanded use of technology, probably half these people could have stayed at home, stayed at work. We could have handled it by email. We could have handled it by a telemedicine visit. And the only reason we didn't do that is because there's no way for me to get paid to do those.
To code it, so, right.
Exactly, yeah. And that's where I see where the role of technology is to really provide that care in between the actual office visits that we need. So whether it's just from a communication standpoint, patients have questions or simple things come up, we can use some telemedicine apps to be able to communicate that back and forth. To do monitoring, so there's all kinds of new devices, whether it's blood pressure cuffs or smart scales or blood glucose meters that can connect to the internet and provide us information remotely. Patients just going about their visits at home, but then it gives us an insight to keep an eye on them periodically when they're not in the office. So I think that's where the technology is going to come in. And I think the beautiful thing about direct primary care is because we are not billing and coding, it doesn't really matter how we charge for those things. If it's a cool device, if it's a neat gadget, we're going to implement it in our office. The monthly fee that patients pay us is going to take care of how we get paid on that. But if it's something that our patients need, we're going to look to implement that and provide the best care that we can.
All right, great. Well, thank you very much, gentlemen. Before I let you go, where can members of the public get more information and doctors who are interested in looking at starting a DPC practice for themselves? You have a great website, tons of information on it, but there's a lot of information out there. Where can people turn for more information?
Yeah, we're always happy to talk to them. FreedomHealthworks.com, like you mentioned, is a great resource. I'd encourage people to reach out to us. You'll most likely get on a phone call with either one of the three of us or another member of our great team here. We have a pretty active social media presence. So on Twitter, you can follow us at FreedomDPC. That's always a fun little account that we try to keep current news from the industry and what we're doing. And at this point, Ren, at this point, you can just Google direct primary care and find out a lot of options in your locality. Like we said before, the awareness around that term has increased so much within the past 12 months that people are really catching on to how great this movement can really be.
Well, great. Well, thank you, gentlemen. Christopher Habig, Adam Habig, and Dr. Rashid Patel of Freedom Healthworks. And if you liked what you heard today, you can help us at the Heartland Institute get the free market perspective out by subscribing to the daily podcast and rating us on iTunes. Thank you for joining us. I'm Anne-Marie Schieber, and I'll be back next time with another topic in healthcare news.